I hope you can all hear me okay. Good morning. It's a pleasure to join all of you here today. Thank you for coming. We are excited to share this important news with you. I had the pleasure of meeting many of the Ventanilla de Salud extraordinary heroes at the meeting last week in Arizona. So thank you so much for joining us today. Today's session is voluntary. We just simply want to share with you once again what this program is and answer any questions you may or may not have, but we are excited to get started. As we shared in Arizona at the Ventanilla de Salud annual meeting, the U.S.-Mexico Border Philanthropy Partnership has secured a grant from the David and Lucile Packard Foundation to support our friends at the Ventanilla de Salud across the United States. Each of you are eligible to present a proposal to support a significant increase in COVID-19 Ventanilla de Salud relief efforts. We know that many of you are leading the way now, and this is intended to help you. You are doing heroic work. We know what this work is because we are the fiscal agent for the Ventanilla de Salud here in San Diego. So we understand every day how hard this work is, how important this work is, and how valued this work is for our community. This is intended to be a trusted, safe, and effective program for coronavirus information, to provide testing and vaccinations for the Hispanic, Latino, and undocumented community here in the United States. The U.S.-Mexico Border Philanthropy Partnership is the only binational group along and across the 2,000-mile border region that unites a vibrant network of national, regional, and local leaders and organizations who are making a difference on both sides of the U.S.-Mexico border. We were started in 2008 by the Ford Foundation, and today, as a member organization, we have over 350 groups from academia, business and corporate partners, government agencies, nonprofit organizations, and grant-making foundations that work with us. We support a network of organizations that build prosperity through leadership, collaboration, and philanthropy in the U.S.-Mexico border region. And our shared vision is a thriving trans-border region where our members collectively lead to create vibrant, successful communities, fostering stronger civil society and philanthropy. The David and Lucile Packard Foundation awarded our organization a large grant to significantly increase COVID-19 vaccinations amongst the Hispanic, Latino, and undocumented community here in the United States. We have arranged to make sure that all of you receive a request for proposals. They were distributed by the email to all 51 local nonprofit community agencies that are working to support the Ventanilla de Salud at the Mexican consulates. And you are now eligible to apply for funding support for up to $31,000 to boost your COVID-19 response. We are working collaboratively with the Mexican Ministry of Health, the Mexican Foreign Ministry, and especially with the Institute of Mexicans Living Abroad, our good friends at the IME, and naturally the Mexican Consular Network here in the United States, as well as with Mexico's embassy in Washington, D.C. The goal of this effort is to exponentially increase COVID-19 vaccinations in the Hispanic, Latino, and undocumented community. We want to get 1 million people vaccinated. We already have 100,000 thanks to the great work of all the community agencies doing this work right now. We already have 100,000, so now we just need to find 900,000 more people to become vaccinated over the next several months. But we can't do this without your help. So we are asking for you to develop proposals that you will send to us that are focused on one or more of these objectives: to engage the community in awareness, stigma reduction, and other activities focusing on increased COVID-19 relief support to our community. We want to provide education and culturally relevant information to the Hispanic, Latino, and undocumented community in the U.S. on the importance of getting the COVID-19 vaccine. We want to support you to develop culturally and linguistically and unique programs and/or outreach initiatives to boost your agency's effort for COVID-19 response to support our community. And finally, you can use this money to conduct trainings, meetings, and community events to increase COVID-19 vaccinations in your community. The application is really simple. We're asking you to submit a short written proposal as to how you will use this money to strengthen your programmatic efforts for COVID-19 services. Send us a detailed description of your project. Describe the new or innovative activities and strategies you're going to do, and why these activities will help overcome barriers or vaccine hesitancy. Do you have other donors? Let us know. How many COVID vaccines do you think you can provide during the 12-month period? Please share with us a brief organizational history in your mission, the population and geographic area that you are serving, your timetable, and the results that you expect to achieve from this money, from this grant, and how you will evaluate or measure your progress. Please share a budget with us so that you can tell us what you're going to use the money on. And you can see we've given you 9 different areas to spend this money in. It can be for technical assistance. It can be for trainings or meetings or community events that you have to put on. If you need to buy PPE or medical supplies, you can use this money for that. Outreach and communications, consultants. If you have to pay the rent on your facility, it's okay. If you have to pay operational expense, the salaries of your people, we don't care. We encourage you to use the money for these support areas, to pay the personnel costs and travel. Remember, at the meeting in Arizona, we told you you can bill the cost of going to Arizona to this grant. We want to sponsor your participation in the annual meeting for Ventanilla de Salud for COVID-19. And as you can see, everything we did at that meeting was COVID-19 related. So this is an opportunity for you to recover the costs you invested to attend that very important meeting. Number 7, answer the general information requested in the cover sheet. Basically, we want to know names and addresses and how to contact you. We want to know that you have a 501c3 and who your fiscal sponsor is. We want to know this information. Let us know who your partners are and other sources of support and plans for cooperation with other organizations. And let us know the qualifications of the key project personnel because you're the director or the coordinator of the Ventanilla, that you're already doing this work. Tell us who you are and what you're doing. We look forward to receiving this information from you. As you can see, we are making this very simple. We want to support all of you. How can you use the funds? Funds should be used only to enhance or increase the capacity to deliver COVID-19 services. So you must use this money to support COVID-19 efforts. You can't use it for the flu shots or, we want you to do COVID-19. If you're doing flu shots at the same time, that's fine. But what we want to do is, this is for COVID-19 vaccinations. So you can do testing at your site. You can do vaccinations. You can distribute PPE. You can do public service announcements in social media, on your Facebook, in your Twitter, in your Instagram, on local public radio. You can do media interviews. You can organize community conversations. They can be virtual or they could be on site. They could be at your local consulate. They could be in their waiting room or in their parking lot, wherever you need to do this. Obviously, working with medical and mental health experts. So you can use this funding also for mental health activities in support of COVID-19. How are you eligible? First, the applicant organization must be a 501c3. I believe we already all qualify because you're the community agency leading this effort for the Ventanilla. We're all 501c3 organizations. So you need to show us your determination letter because we can only make a grant to a 501c3 organization. This is a non-negotiable. The organization requesting must be a 501c3. We cannot give this money to government. not in the United States, and certainly not in Mexico. Your activities must be completed in the United States. I know many of us here in the borderlands are doing innovative projects in support of Mexico and Mexicans on the other side. But your activities in support of COVID-19 for this grant must be completed on US territory. You must do it on this side of the border. You should be the nonprofit community organization leading the Ventanilla at the local Mexican consulate or health-related organization. We are also asking that you demonstrate that the resource, the annual contribution for your agency from the IME, we want proof of payment that you've received your support from the IME. We're all getting it, so it should be very easy to get a copy of the bank deposit for your institution that support has arrived. Obviously, we want you to show that you're working on COVID-19. I believe most of the Ventanillas will easily be able to provide this information. Obviously, we want to make sure that we have the local leadership and the local financial support and local program management. We want to know that the Consulate of Mexico is supporting you in your effort for COVID-19. And obviously, at the end, we need you to comply with all narrative and financial reporting that'll be outlined in the grant agreement that'll be signed once the funds are awarded. We must tell the Packard Foundation in December 2022 how we did on this project. So we're going to ask you to finalize your efforts by the end of October in 2022. So you'll have 1 year, maybe 2 weeks shy of 1 year to get your project completed. And we are excited to have this happen. What must you send us? Have your community agency send us their IRS determination letter. Please send the latest financial record or your audited financial statement. We need your 990. We need to know who your board of directors are, and we need to see your organizational budget. So this is just like requesting a grant from any other foundation or corporation that is supporting your work, but we're trying to keep this as simple for you as possible. The application deadline is Monday, November 15th. So by the time the application went out, we've given everybody about 3 weeks to complete this proposal. And we're asking that you send this to us via email, must be received via email on or before November 15. And the email address sending this to is grants@borderpartnership.org. We are very excited to hear from all of you. The BPP Board of Directors will review all the proposals and notify the organizations in writing that you will be supported. Grantees will be required to send a final financial and narrative report to us at the end of the grant period in a format that we will provide you. So we anticipate getting all of this money paid out before the end of the year. We want to make sure that you can report this on your year-end financial, that this money has come into you. So as soon as you get your grant proposals to us, we're going to get them reviewed and approved, and we will get the payments out as quickly as possible. And this is my contact information. So what we want to do now is I'm going to open this up for questions. So I'm going to ask my colleague Salif, and I don't want to stop the share. I want to make sure I leave my contact information up. That way everybody can have it. So Salif, do you have, can we allow people to raise their hand and ask questions?
Yes, hello. So if you raise your hand, I will allow you to speak.
So Salif, now I do ask, in order to allow everybody that has a question, let's be brief. We're not looking for stories. We just want to answer questions. So I'm going to ask my colleague to identify you, and then we will proceed and answer your questions. Salif, please call on who you want to have ask the question.
Rosalinda, we hear you.
She's still muted.
You're
She's
muted.
muted, Salith.
Rosalinda, can you unmute yourself, please? If not, we'll move on until the audio is fixed. Leah?
Hi, can you hear me?
Yes, we can.
Hello? Okay, perfect. So I'm a bit confused because we were invited to apply to the RFP by the Mexican Consulate in Philadelphia, and we do partner with the Consulado on some health promotion activities, but as far as we know, we are not one of these 51 organizations. We don't lead the Ventanilla, and so we're just wondering if we're actually eligible for the grant.
Okay, so that is a great question. And what that tells me is if the consulate, and what we're going to have to verify, and I'm going to invite you to help us in the verification process, okay? So what this tells me is the Ventanilla de Salud perhaps doesn't support COVID-19. And so the consulate is identifying you as that community partner. If we get a communication from the consulate as a part of your proposal, saying that you're that agency in their local community that they want to be considered because their Ventanilla doesn't participate, we will accept your proposal.
Okay, and so will we still need proof that we're receiving funding from the email or no?
Well, they got funding from the email.
So they got funding.
I want to know where that funding went. So
Okay.
I need you, so in your proposal, because we will only entertain one in support of that consulate. That consulate's going to need to help you convince us that you're the agency.
Okay.
We will only help one agency per consulate. And so what that tells me is the consulate perhaps has a Ventanilla that perhaps focuses on something else.
Mm-hmm.
So if you convince us, so I'm telling you that, yes, you can participate. I can't promise you it. I need to know more from that consulate, why they're telling you to support, and I want to know where the email's money went.
Okay. And then the second very quick question is, do we need to be actually providing vaccine, or can we just do vaccine promotion activities, et cetera, or must we provide actual vaccine?
If you are the agency that you have others and you have partners and you're helping get people in your community vaccinated, that's what we want to know. Each consulate's program is going to be different. We want to get people vaccinated. Just because they get a shot in the arm doesn't, there's lots of ways to get people vaccinated.
Okay. Okay, great. So thank you.
Tell us in your proposal what you're going to do.
What we're going to do. Perfect. Okay, thanks so much.
Salith, next question.
Gabriela, Constant? Gabriela, you're muted. Can you unmute yourself, please?
Yes, this is Gabriela from Indianapolis, Ventanilla de Salud.
Hey, I'm from Indianapolis.
Oh, nice.
I lived in Indianapolis before I came to San Diego. I lived in Broad Ripple. Welcome.
Thank you. And I have my family in San Diego too, so I visit there very often.
Well, look me up the next time you come here.
I will. My question is, how much is the grant? I came in a few minutes late, and I don't know if you gave that information.
$31,000.
Okay. All right, that was my only question. Thank you.
Salith, I see a question here in the chat that somebody said, how many grants will be approved? We are, I'm willing to commit that there will be a grant for each Ventanilla program across the country, as long as you are eligible and meet the requirements and present a compelling proposal. Go ahead, Salith.
Diana?
Good morning. This is Diana Gomez from the Ventanilla Salud in Boise, Idaho. So I had a question in regards to the time frame. So I know you mentioned we will basically have a year to complete the project, but I'm wondering about any reporting is there a deadline for us to submit a final report in terms of the activities?
Yes, you're gonna have a little less than a year, you'll submit your proposal mid-November. I don't, Salith, what was that date? November, I have to switch back to this. I believe it said November 15. You will submit your proposal November 15, 2021, and you must submit your final report to us by October 31, 2022.
Okay, and so in regards to the specifics of the reporting, are there any specific guidelines or requirements in terms of how we report that? So for example, a number of people reached, will there be any more kind of specifics to that?
We want to know how you achieved what you set out to do in your proposal. Give us the final report. What did you do for COVID-19 in your community and how many people benefited? That's what we're going to ask you.
Great, thank you so much. Appreciate it.
Elena?
Hi, thank you. Can you hear me?
Yes.
Hi, Andy. I have two questions. The first one is when we are receiving the resources after our proposal was approved, and the second one if there is any preference on how much money we spend in each of the sections that you mentioned, like for example, how much in trainings, how much in paying for operation, or how many in the other sectors that you mentioned. Those will be the two questions.
So you're going to tell us, you tell us where you need the money.
Okay, perfect. And the other is when we are receiving the resources after our proposal is approved.
We're going to get them. Our goal is to get it out before the end of the year, but it might trickle into the first part of January, but we're going to get it out as quickly as possible.
But we can start putting the activities that we have as on November and December in the report.
Correct.
Okay, perfect. Thank you very much.
Because we're going to let you build your trip to Arizona that happened in October.
Okay.
So you can go back and you will be able to go from October to October.
Okay, thank you very much.
So Edgar Carmona asked the question, the proposal should cover January 1 to December 20. No, it can go back from October 2021 to the end of October 2022. Nancy Ramirez wants to know if we can make the PowerPoint available. Absolutely.
Yes, I'll send the PowerPoint via the chat shortly. Rosalinda?
Somebody asked if there's going to be a monthly report. No. You got to remember, I run a Ventanilla too. I don't want to do monthly reports. I want to give you the money so that you can do your job freely, openly, and without hassle. We want you to focus on getting as many people vaccinated in your community possible.
Okay, thank you.
Great question. Could you send the PDF in English? I know it was sent in Spanish, but not in English. The PDF, Maria Rodriguez asks about the PDF in English. When we submitted the convocatoria to the email, it was in the same document, it was presented in both English and Spanish. So you should have it, but Salith, we will arrange to distribute out to everybody. We have a directory of the Ventanilla de Salud people, but I don't have the directory of all the fiscal agencies. So we can, I will work with my friends at the email to redistribute that.
Hi, Corinne, do you have a question for us?
Yeah, I maybe missed this, but is there a formal application that needs to be filled out, or just send in the documents you guys requested and that's it?
send in, just put it on paper.
Okay, that's it. That's all I need to know. Thank you.
So somebody, Rosalinda, is asking if the payment will go directly to the organization or to the consulate. It will go to the organization. We cannot send money directly to the consulate. The money must be distributed from us directly to a 501c3 organization. So the money's going straight to the community agency leading the effort.
Hi, Humberto. Go ahead and ask your question, please.
Yes, hi, do you hear me?
We
Hello?
do.
Oh, okay, thank you. Thank you for the information, Andy and everyone there. I'm the coordinator for community affairs at the Consulate in Philadelphia, and answering Leah's question. Yes, we're working with a 501c3, but they are our Ventanilla de Salud, but they are focusing on mostly in mental health for children, which we will try to obviously to encourage them to get this fund for COVID and do, I don't know, workshops and for mental health as well towards COVID. But we invite other organizations who are focusing on spread the encouraging of getting the vaccine, the COVID vaccine, through Leah's organization and other organizations that are for Latino communities, so we can work together. And I was thinking maybe putting in the proposal to have these two partners with the Ventanilla de Salud. Is that something that we can do? Or even though, I mean, I know the funds will be for the Ventanilla de Salud agency, but I just want to clarify that they are not specifically working for COVID at the moment, but we will try to work with other organizations to do this.
So thank you, Consul, for joining us today. I'm going to invite that let's have a separate conversation related to your consulate and what's happening in your community. This is a special case. I know my good friend Eric Hernandez from IME is here. I'm going to ask Eric to also work with me, to work with you, because we need to figure out the solution for we want to help your community, but I don't want to be in a situation where your Ventanilla de Salud program is feeling shortchanged. So we're going to have a conversation after this call, okay?
Okay, thank you.
Muchas gracias, Eric, por acompañarme en darles una respuesta. Any other questions? Do you have a restriction on zip codes, rural, urban regions? We do not. You are free to tell us where you're working. Consulados móviles are extraordinary. We do them as often as we can here in San Diego. We've even been creative to do them on private ranches to get the workers, 50 to 100 people at a time, to get them information that they need. So we are your ally. We know this work because we've been doing this here in San Diego since 2016. I'm a huge fan of the work of the IME. Eric Hernandez is on this call. I consider him a good friend and colleague. I appreciate him. I also want to give a shout out to the director of the IME. He's been a staunch supporter of this effort. Luis Gutierrez, ingeniero, muchísimas gracias por su gran apoyo. We appreciate the opportunity to support all of you. So the intent here is to be helpful. The intent here is to get you more resources. We're all operating on shoestring budgets for this work to happen. And Mexico invests in this, and we all have to raise money. And so my motivation as being an ally of this program was to get us relief and to get us extra resources to address this pandemic, which is hurting our very community. And so that's why we're doing this. We want to be helpful to you and make this process as seamless as possible.
Hi, Andy. This is Edgar from Dallas, Texas. And I have a question about the grant period. I know you said that we could go back all the way to October this year to October 2022. If just for logistics and organization wanted to submit the proposal from January to December, will that be also acceptable, or is there a deadline of how far we can go into 2022?
Your deadline, I must tell the Packard Foundation in December of 2022 how we accomplish this grant. So your deadline is the end of October 2022.
Okay, so therefore, it should be from October to October. Okay, got it. Okay, I just wanted to be clear that there was an actual deadline. Thank
It
you for
is,
that.
because I'm anticipating that everybody's gonna have to tell me how they did during October, which is a very busy month for the Ventanillas, and I apologize for that, but we have to have the time to collect all the data so that we can comply with the Packard Foundation in early December. So that's why we're giving, because I'm anticipating we're gonna be knocking on a few doors, trying to get the reports in.
And the funds, how will they be released? In just one payment, or will it go in cycles?
One payment.
One payment? Okay, do you project when they will be released?
As quickly as we can get the proposals reviewed and approved, we will release the funds.
Okay, great. One last question. For the proof of funding from the Institute of Mexicans Abroad or the Consulate of Mexico, usually the way it works in Dallas is we might receive the funding for 2021 in December. So, but we do have the proof of the funding for 2020. Will that suffice?
No, 2021. Tell your consulate to pay you.
Okay,
They
I'll
have
work
the
on that.
money. I've been insured. I've been insured by the email that the funds were distributed. So make your consulate prove it. Make them give you the money now.
And they usually issue receipts for it. Would that suffice as well?
I want your, no, I want your receipt. I want you to show me in your bank account that you've been paid.
Okay, I'll work on that. Thank you.
I don't understand Diana Gomez Romero's question. These funds are from what source? They're from the U.S.-Mexico Border Philanthropy Partnership. We raised the money in a grant from the Packard Foundation to support COVID relief, COVID-19 vaccination and programming here in the United States in partnership with the Consular Network of Mexico. That's the source and the motive. We want to vaccinate the people.
Yes, sorry, I just want to clarify. My question was in regards to, I thought I had heard something about funds for the Arizona trip, but I'm not sure. I did log in a little bit late, but I just wanted to.
You are correct. So in the Ventanilla de Salud held their annual meeting in October this year, just a couple of weeks ago in Arizona. It was a multi-day meeting where the Ventanillas had to spend some money. They had to buy an airplane ticket. They had some meal costs. They probably had to take a couple of Ubers. The viáticos, the whatever expense was incurred to get your people to the Ventanilla de Salud meeting. We're simply offering you an opportunity to bill the cost of that trip to this grant.
Oh, I see, I see. Thank you for the clarification.
You're welcome. How many people are we looking? We want to show that the Ventanilla de Salud program was uber successful in vaccinating. We want to go for 1 million people. Through the Ventanilla de Salud program in 2020, 3.1 million people in the Mexican community across the United States received medical and mental health care services. So we're trying through this grant to try to get 1/3 of those people to come back and be vaccinated. My good friend Eric Hernandez shared with me about a month ago that over 100,000 people at this time have been vaccinated. All those, so we already have 100,000 people. Now we only have to find 900,000. The number is not a silly number. There's such a need for the vulnerable, important people in our community to get access to a vaccine. And we think that the best way to have this happen is through the Ventanilla program.
Hi, Andy, and hi, everybody. I just want to, my name is Ana Ochoa. I'm the Consul for Community Affairs at the Mexican Consulate in San Diego. And I just want to, say kudos to BPP and Andy Carey. And for anyone, I don't want to take too much time because I know there are many questions, but we've been working with BPP for more than 10 years. There's a very serious organization, and the efforts that they are doing to support at this time, not only the Ventanillas, but working with COVID-19 and making this effort is awesome. It's amazing. And I just want to say thank you for this opportunity. Thank you for working also with IME. Thank you to the Ingeniero Gutierrez for supporting this initiative too, to Eric Hernandez, to everybody, at IME also for supporting this initiative from the Health Window here in San Diego. So if anybody has any doubts, they are a very serious organization. They are a health window. So as Sandy said, they do know all the reports that you already need to deliver. So they will be very easy working with them because they know how you operate. They operate the window here for 10 years. So thank you so much, Andy, for the opportunity. And thank you, Ime. And thank you, everybody, for being interested in participating in this effort.
Mi querida Ana, muchísimas gracias, Cónsul Ochoa. Agradezco tus palabras, agradezco tu amistad y un fuerte abrazo para el equipo consular aquí de San Diego y alrededor del país. Y también un fuerte abrazo para mi gran amigo Eric, es un gran colaborador. Eric, a favor de compartir mis saludos también al ingeniero Luis Gutiérrez, el director del IME, porque entre todos podemos hacer una maravilla aquí en nuestro país. And we want to vaccinate our community. They're at high risk, and we are very concerned for them and their families, and we want to create opportunities for them. And so that's what the intent is for all of you. So I see another question. It's how much is estimated to give out per Ventanilla? $31,000 is available to each Ventanilla for this program, as long as you comply with submitting a good proposal and submitting the documentation that's needed. And I'm going to work with Eric to resolve the issue for the Pennsylvania consulates so that we can make sure, I just want to make sure we don't have a problem that develops so that we can come up with a good solution for them and to make sure that the consulate is on board. So we appreciate it.
Oh, Andy, creo que no me había fijado que estaba mi micrófono encendido, pero quiero nuevamente sumarme a estos agradecimientos y decirles a todas las promotoras y cónsules comunitarios que el día de hoy se conectaron, que como lo dijo Andy, esto comienza en octubre y es un trabajo que todas y todos ustedes ya están haciendo, por lo cual ya tienen que reportar para este grant. Por lo tanto, creo que todas las ventanillas de salud aplican y no queremos que nadie se quede atrás. Entonces, muchas gracias nuevamente a la Alianza Filantrópica Fronteriza, a Andy por todo este esfuerzo, y Cónsul Ochoa, pues saben que cuentan con el Instituto de los Mexicanos en el Exterior. Yo le paso al ingeniero Luis Gutiérrez Reyes sus saludos y saben que cuentan con nuestro apoyo. De verdad, gracias a todas las ventanillas de salud por este interés de conectarse el día de hoy, y a los cónsules comunitarios. Andy, pues invitamos a los cónsules comunitarios y a los encargados de asuntos comunitarios para que apoyen a las agencias, para que participen en esta convocatoria que, como nos lo has descrito, es muy flexible. Entonces les agradecemos mucho. También el día de hoy se conectó, además del equipo de salud del IME, se conectó Leslie Martínez, que nos va a apoyar mucho para que esta convocatoria llegue a todas las promotoras y que nadie se quede atrás aplicando hasta el día 15 de noviembre. Les mando un abrazo desde el IME y pues nuevamente muchas gracias a todas y a todos.
Muchas gracias, Eric. Muy amable de tu parte, como siempre. Te aprecio mucho. We have a question from Marta Lopez. Can children be counted in the people vaccinated? Absolutely. Let's get our community vaccinated. Let's get them informed, get them the information so that they can make the best decisions for them and their families. I think there's 2 more hands raised. Celine? I see people are asking, can they use the money for incentives or gift cards? If that, tell us what your strategy is about if you want to give out incentives. If that's part of your strategy, put it in your proposal. We don't want to get in the way of telling you how best to achieve your goals locally. We all know what we're trying to do locally.
Alma, we can hear you.
Oh, my question was answered. That's why I lowered my hand, but thank you.
There will be a second information session that's scheduled for November 2nd at 9 a.m. Pacific Standard Time. If you joined today and didn't ask your question, or you have more questions, you're welcome to join us on that day. Or you have my contact information in the slide. I'll put that back on the screen. We want to make sure that you have questions, that we answer them. We're here to help you. That's why we're doing this. We want you to be successful.
Hola, buenas tardes, de Ventanilla de Salud de Miami.
Hola.
¿Sí me escuchan?
Sí, sí escuchamos.
Hola. Gracias. Andy, yo tengo una pregunta. En Ventanilla de Miami nosotros estamos inscritos ante la IRS. Sometimos la inscripción para hacer una 501 en el mes de junio, pero no nos haya llegado la respuesta porque nos dicen que por la cuestión de la pandemia ahí están como muy lentos y nos dijeron que podemos tardar de 6 a 8 meses en recibir la respuesta, pero tenemos el certificado de que nosotros ya aplicamos, solo estamos en respuesta de inscripción. ¿Podemos aplicar también en este programa o no?
Directamente no. So you exist, but you're working formally through an agency, correct?
Okay.
Como, mire, para aclarar, me imagino que están trabajando hoy día a través de una agencia fiscal, ¿verdad?
Sí.
Ellos tienen que aplicar.
Ok.
Tiene que ser 501c3. No podemos entregar dinero a una entidad que no es 501c3. Es obligatorio.
Ok, gracias.
Ok, suerte. Más preguntas. Are there any more questions? Salit, do you see any more hands raised? Elena Aragon has raised her hand, I see.
Yeah, I have a question regarding the proof that the money of the email is already in the bank account of the fiscal agency. We are right now working in the process to deliver a check to the fiscal agency for the amount that the email sent. But we believe that the check will be ready until next week, or maybe if we're lucky enough tomorrow. In case the whole process is not finished by the time we have to deliver the proposal, submit the proposal, sorry, is there any other proof that we can add in our proposal to prove this?
I would, I'm going to ask my good friend Eric to help pressure the consulates to pay out the resources that the EMA has provided to your agencies prior to the deadline that we are asking. It must be part of your proposal.
Okay, thank you very much. We will also then press the fiscal agency to put the money in the bank. Thank you.
Yes. Maria Rodriguez is asking if this grant has to be done through the fiscal agency. So the consulate has determined who the community agency is that they're providing the EMA funds to. That's who we're going to give the money to. So they are handling this on your behalf. They have to actually request the money for you to be able to do this work. We can only give the money to the 501c3 agency. Muchas gracias, Eric. Yo sé que cuento contigo. Yes, Salif, I did say that if that they can, if they want to use part of this money for incentives and gift cards, that if they think that's a great strategy to get more people vaccinated, they can do that. Any other questions? Any other hands raised, Salif?
No, there are not.
Very good. Well, best wishes to all of you. You have my contact information, I believe. Let me clear out of the chat. You can reach us. There's my name, my title, my email address, our phone number. I invite you to communicate with us if you have any additional questions. We look forward to supporting all of you, and best wishes to you as you make your proposals to be considered for this grant. We look forward to supporting the work of the Ventanilla de Salud across the United States. Muchísimas gracias a todos. Están haciendo una labor extraordinaria y realmente son héroes durante esta pandemia tan complicada, sobre todo para nuestra comunidad. Thank you all for all that you are doing. We appreciate you very much, and best wishes. Thank you so much.